Welcome back to SheCan, where role models lead by example by telling their stories, their lived experiences and insights for all of us to be guided and supported on our journey. And I'm very excited to talk to Dr. Ghazala Aziz-Scott this morning. Dr. Ghazala, welcome to SheCan. You're an expert in integrative women's health at the Marion Gluck Clinic in London, specializing in functional medicine and bioidentical hormone replacement. You studied medicine at Cambridge and graduated with a master's in neuroscience, medical ethics, and law. And then you transferred to Oxford for your clinical training and became a GP in a large NHS partnership in West London. And then you retrained at the Marion Gluck Academy and Institute of Functional Medicine, and you've been practicing there for a while. Dr. Ghazala, tell us a little bit more about yourself and how you feel you got to where you are today.
Okay, so as you mentioned, I started my medical training at Cambridge University. So we had a very strong scientific basis to my training there. So I did 3 years there, and then I went to Oxford for 3 years, and I did my clinical training there. And then I was always not really sure of what speciality I wanted to go into. I particularly enjoyed the sort of general idea of looking after someone holistically. So I've always been interested in the psychological, physical, spiritual aspects of someone's life, and also looking at how their life journey fits into their what their current health issues are now. So I always also wanted to sort of blend family life with my career, and I always wanted to have children. So I then decided that I was going to train as a general practitioner. I did actually think about going into epidemiology just before I went into general practice, and I got a place at Harvard to do a master's in public health. But then I thought, well, maybe I'll work for a while. Then I got into general practice, and then I actually found I really enjoyed general practice. So I was a partner in a practice in Ealing for 23 years. And general practice during that period of time really changed. So when I first went to general practice, it was real family style medicine. So, you looked after a population of people, you were their GP, and you followed women through. So in that 23 years, I had women who were roughly the same age as me. We had our children together. We went through our children's different developmental stages together. Then we became perimenopausal together. So, it was a really lovely sort of community. And I think when it started to really change was during lockdown.
Mm.
Um, and also, general practice was beginning to be much more underfunded, over the last 10, 15 years. And then COVID was really the final nail in the coffin, where I never ever thought I could do my job online. I always loved that sort of interaction between patients. I love the energetics of, being in a room with someone and really feeling what's going on with them. And then, COVID really changed everything. We were doing a lot more online consultations, and then doctors realized, well, actually, we can potentially function online. And so then the whole system of the way my practice functioned changed, and we had this system called Ask My GP, where we had no patients booked into the clinic, and we would have to basically try and deal with things on the phone or online, and then only bring people in if we felt they needed to be seen. So
Mm.
that just changed the whole dynamic of general practice for me. And then as my daughters were getting older, so general practice did offer me a really good work-life balance. I full days a week when my daughters were at primary school. So I had 3 days a week where I was a partner in general practice, and then 2 days a week where I could be at home with them and sort of be a mum as well. So I valued that. So from the ages of 40 to 50, I worked 3 days a week, which I think is the perfect work-life balance for a working mother. And then as they were getting older, we went through lockdown. It was actually during lockdown, just prior to lockdown, I had done the Marion Gluck Training Academy course, and they sort of said, "Oh, you seem to be really interested in this." And I said, "Well, it's really giving me a very fresh perspective on, women's health." So then I started working 1 day a week for the Marion Gluck Clinic. privately, and then I trained with the Institute of Functional Medicine, and I went over to Seattle and I did their introductory course. And I thought, wow, this is actually the kind of medicine that I've always tried to practice, but now the structure of the NHS means that I'm just not able to give my patients that level of time and detailed interaction that really helps me understand on a deeper level how can we get them better. So I did the introductory course in Seattle, and then we went into lockdown. But one of the great things about lockdown was then those courses from the States were then um, sent online, and then I was able to do all 6 advanced modules within a year because, I was at home a lot. I wasn't socializing. I was able to focus. So it was actually really serendipitous that I actually then finished my functional medicine training during lockdown. And then I decided that I was going to take a sabbatical, work full time in functional medicine, and then see how it goes. At the same time, Marion Gluck, who was a real pioneer in bioidentical hormones, she came to England about 20 years ago. And at that time, no one was doing bioidentical hormones. She'd learned about this in Australia, and she'd also trained in Germany, where there's a much greater tradition of sort of chiropractors and more integrative style of medicine. So she brought that to the UK 20 years ago, where no one else was doing that, and people were still being given synthetic hormones. So Marion Gluck had an incredibly successful career, having brought this, bioidentical hormone treatments to the UK. She grew her clinic over 20 years, starting off with a compounding pharmacy in central London where, I think she was literally making up medications in her back room. Then she was like, had a little tiny pharmacy who were helping her. And then over time, she built a massive specialist pharmacy that compounds all different kinds of medications. And the clinic grew from just her to now, under my leadership, we've got 10 or 11 doctors. So we've seen a real growth across the business. So Marion Gluck approached me and said, would you like to become my clinical lead doctor? I'm, obviously she was getting older and thinking about retiring. And so I decided that, I would take on the clinical lead role and also bring functional medicine to the Marion Gluck Clinic. So up till then, largely the focus had been on just hormones, but I always see hormones as a function of your general health. So I wanted to add functional medicine to our offering so we could look at people's health in a much more a wider, more integrative way. So in 2022, I became the clinical lead formally. I resigned my position at the NHS, and then we brought functional medicine to the Marion Gluck Clinic.
Dr. Ghazala, how inspiring is that story? So tell us a bit more on how, if a woman is listening and thinks, I really need to go and see them, how does it work for a client to come to you? What kind of care do you give them? You have so many different modalities that you work with, which is so much more holistic for the person that walks through the door. So talk us through a little bit what that offering is.
Sure. So in the last 10 years or so, the mainstream medical profession, and the British Menopause Society and the NICE, National Institute of Clinical Excellence, they have recognised that bioidentical hormones are the gold standard for women. And all of those studies that were done in 2002, which showed an increased risk of breast cancer, were done with synthetic hormones. So the idea is now that actually bioidentical hormones are, when used in the right way by qualified professionals, are very safe and can be used long term. There's also this real understanding that hormones are not just for the reproductive phase of women's lives. We now know that because women are living into their 90s and, that actually we spend from, if 51 is the average age of the menopause, we are spending almost a third of our lives in the menopause. So those hormones, which, in the old days, women would die, had a much shorter life expectancy. Now we have this scientific understanding of how important those hormones are for other aspects of our health. So they're important for our cognitive function, our heart health, our bone health, our general well-being. And now we know that proper hormone balancing is also incredibly important in longevity medicine. So longevity medicine is a big trend in medicine at the moment, where people want to live longer and healthier. So you can actually get bioidentical hormones in the National Health Service. However, there are much stricter guidelines on what testing can be done. So women are not offered testing over the age of 45. So if you go to your general practitioner and you say you've got certain symptoms, you are not offered any kind of testing. They give you a blanket dose of HRT. Now, we know that giving anyone a blanket dose of anything is not really a good idea. Every human being is very, very individual. We have individual physiologies, we have individual psychological makeups, we have individual genetics, we have individual ways of living our lives. So we have to look at all of those factors when we are trying to assess what is the best solution for a patient. So this sort of blanket dose of HRT, I mean, it's wonderful in England, at least the National Health Service offers something for everybody, but it doesn't offer you a personalised service, which is where the Marion Gluck Clinic comes in. So regulated bioidentical hormones are excellent, but it doesn't work for everybody. What we offer at the clinic is we test our women. We take a very, very detailed history. We will spend between 45 minutes to an hour with our patients. Functional medicine, I will spend 75 minutes with my patient, and we'll go through absolutely everything about their medical history. So we have a really good idea. Now, some women in midlife may present with certain symptoms that could be hormonal, but they could have other things going on. They could, for instance, in midlife, women are more likely to become hypothyroid. So a thyroid problem might be impacting their health. Women can often have very, very heavy periods because of the perimenopause, and they might become iron deficient or anemia. That could be impacting their lives. So unless you check everything, you're not going to know what is the true cause of the symptoms. So initially, when a patient comes to see us, we do an initial blood profile where we'll check absolutely everything. Even the way we check hormones is way more detailed than you would get in a conventional medical setting. So we also check other hormones, like there's a hormone called DHEA, which comes from the adrenal glands, which is also very important for hormonal balance, but that's not really recognized in mainstream medicine. So, even a hormone profile, in the conventional sector will be more limited to what we offer. The other thing we offer is a lot of functional testing. So we will also look at other factors that could impact your general well-being and hormonal health. So one of the things that I see a lot of is adrenal dysregulation. So adrenal dysregulation is where your stress hormone, cortisol, has an abnormal pattern. So normally we would expect cortisol to go up when we first wake up during the course of the day, and then gently go down during the course of the day. So, we wake up with an anticipation of starting our day, our body is energized, and then we're supposed to function. However, if people have had a lot of chronic stress, they've had constantly high cortisol levels, what then happens? Because too much cortisol is damaging to the body, cortisol production is switched off, and the body can go into a low cortisol state, or the body can remain in persistent fight and flight and have a high cortisol state. So we're able to do functional testing where we can actually look at those cortisol patterns over the course of the day, and we can see, is it actually adrenal dysregulation that's driving this person's hormone imbalance? It may not be that they're perimenopausal. It may be something else. So it's an enormously helpful tool in helping patients understand what's going on with their body. Someone can have completely normal blood tests, but can have abnormalities on the functional testing. So it gives us a much deeper dive into what's going on with a patient's health. The other thing that we can look at is gut health. So there's now, a real understanding of how important the human microbiome is. So the microbiome is the collection of trillions and trillions of bacteria in our gut that are responsible for every aspect of our health. So the gut really is the central axis of your health, and it has an impact on the immune system, on your hormonal balance, on your metabolic health, on so many different things. So your gut has to be healthy for the rest of your health to be healthy. So we have a very amazing way of looking at all of these parameters through functional gut testing, where we can look at, how, your levels of digestive enzymes. We can look at how your gut is metabolizing lots of different things. We can look at the different bacterial populations. Have you got an overgrowth of yeast or any bacteria? So by addressing the gut and rebalancing the gut, we can get other aspects of your health much better. When it comes to hormones, hormones are actually excreted, cleared, and detoxified in the liver, and then their estrogen is detoxified in the gut. So it's also important to look at how does someone detoxify their hormones. So you might be giving someone hormone replacement therapy, but we want to make sure that that person is clearing those hormones from their system, because otherwise those hormones are going to build up. So we do need to look at that patient as a whole to work out what's driving their symptoms, are there other health issues involved, and what's the best optimum solution. So we are able to prescribe regulated bioidentical hormones, but our speciality is compounded treatments. So at the specialist pharmacy, we can actually manufacture hormone preparations specific for each patient. So we can actually make sure the dose is the right amount for each patient. We also have many different ways of delivering those hormones. So we can give people those hormones transdermally through the skin. We can give them orally. We can give them as a lozenge. We can give them as a rapid dissolve tablet. We can give things as pessaries. So we can actually formulate the right method for each patient. I mean, most people, the gold standard for estrogen hormone replacement, for instance, is transdermal through the skin. But some people don't absorb it very well. So you might be giving them lots of transdermal estrogen, but they're not absorbing it. So it's great to have alternatives. If that's not working, there's something else you can try.
Dr. Ghazala, as I'm listening to you, I want to give you a shout out because it's an incredible service that the Marion Gluck Clinic provides, and you're obviously heading that up now. I have had the worst perimenopausal phase very early on in my beginning of my 40s, and I went to my NHS GP and I got prescribed something that was such a whopper for me. And I had severe panic attacks for, I think, up to a year. And I thought, this can't be right. It can't be that I have to live like this. I mean, I felt like I can't leave my house anymore. I had 3 children and a job. I really didn't manage. And then someone told me about the Marion Gluck Clinic, and I went there, and that's how my journey really completely pivoted, because I was looked at as a whole person. I was giving bioidentical replacement for me, as in, someone looked at me, my whole body and mental state at the time. And that's where I became myself again. So this is a big shout out to the Marion Gluck Clinic. I'm now with another doctor 10 years later, but I mean, it was a pivotal point in my journey because it really didn't work. And I think I fought for a diagnosis for about a year because I didn't feel right. And no one thought this could be menopause or perimenopause. And so really the Marion Gluck Clinic for me in my journey was instrumental. And I think there is a lot of room for us to fight to make this more mainstream, because there are costs involved. And I'm very, very, very fortunate to be able to have been able to come to the Marion Gluck Clinic as a client and get a personalized service. And not all women are able to do that. So I think there is a lot of room for us to bring about change also in the National Health Service to make this more widely available. Dr. Ghazala, so tell us a little bit more about how you obviously felt it. You wanted that personalized, you wanted to be able to give this personalized service. Do you feel you are really now where you wanted to always be? This pivot in your, in your doctor journey, is this what you sort of really wanted, and that's what you're really here for? Is that what really matters to you now?
Yeah, I think I absolutely love my job. I mean, I think a lot of people, young doctors who are in functional medicine, they don't have that solid clinical background that I have. So, I was a conventional mainstream doctor in the NHS for 30 years. and I was a partner in general practice for 23 years. So I've got this very solid clinical basis, which means that nothing phases me. I've dealt with absolutely everything in my clinical career. So now being able to use that big sort of, bedrock of knowledge, plus now being able to build on what I'm able to offer patients has been so rewarding. So, I mean, the problem is it takes about 17 years for scientific research to filter down into conventional practice, and that's a hell of a long time. So, what's really, amazing is that there are these amazing functional tests. There's genetic testing. There's so much we can do to actually help our patients on an individual basis. So I feel very privileged that I'm able to do that at the clinic. I'm able to, carry on my lifelong love of learning. And so I'm constantly learning new stuff. And I'm able to bring that to my patients. I'm able to use those skills. But obviously, unfortunately, that's all in the private sector. The functional tests that give me so much information, they're not available on the National Health Service.
Yeah.
So that is very disappointing. But I would say that, yes, I really feel that I'm exactly where I never dreamed of feeling so excited about my job. Unfortunately, I think if I was still working in the NHS, I would be literally thinking, right, when's retirement?
Yeah.
But now I just want to carry on working because I'm so inspired by also how this approach really gets people better.
Yeah.
That's what I really love, and we use those bioidentical hormones not just for perimenopause and menopause. And it's interesting you talk about your perimenopause journey. Now, perimenopause, many women are estrogen dominant. So if you give that woman a blanket dose of estrogen and progesterone, you are going to make them feel dreadful.
Yeah.
And so we see so many women who are then, their estrogen levels go sky high. I've seen one woman who then developed a lobular carcinoma in situ of the breast. Now, she was put on this massive dose of estrogen and progesterone by her GP in the perimenopause, and there was no way, that very high dose of estrogen did not have an impact on her breast tissue. I mean, we can't prove it, but, it followed. So I think it's so important that we don't overdose people with hormones, that we actually look at things carefully. And, a lot of times in the conventional sector, because they're not looking at things in detail, or they don't have the tools to look at things in detail, what then happens is that they just keep hiking up the hormones without looking at, well, what's going on. So that is, something that I really hope does get addressed in the long term. The other thing is we can use our bioidentical hormones for many other women's health conditions. So we can use them in endometriosis, in polycystic ovarian syndrome, in PMS, in PMDD, in fertility. So our hormones have huge applications in all aspects of women's health. When you look at conventional gynecological practices, largely, most gynecological problems, they think, right, instead of thinking, well, what can we do to balance the hormones, the thinking is, what can we do to switch off ovulation? So the combined contraceptive pill is such a common treatment for many gynecological conditions, endometriosis, or, it's like, well, okay, we don't know what's going on. Let's just switch ovulation off. Maybe that will help. But it's not dealing with the root cause of what might be driving someone's disease. So, I mean, there is I have had sort of my knowledge on women's health has just sort of been exponential over the last 5 or 6 years, really, because, I'm just focusing on this aspect of medicine. And obviously as a GP, I did see a lot of women's health anyway. But there's still so much research that needs to be done. Most medical research is done on a 70-kilogram adult male, not on a woman, and so we need to have much more research going into women's health. And, a lot of the amazing things that we do in the private sector, hopefully will become available mainstream. But the thing is, it's labor intensive, it's resource intensive. And obviously the NHS is a population medicine system. So, they have to try and do the best for everybody. rather than focusing on an individual. I mean, I think people also have to have a change in their mindsets because you can't expect the NHS to provide absolutely everything.
Yeah.
So I think having that sort of understanding that maybe you do need to invest in your health, maybe you do need to advocate for yourself, maybe you do need to research what other things might be available to you and then try and find solutions, you
Yeah.
know, and take responsibility for that, because unfortunately, I don't think we're ever going to get to the stage where, I mean, as a GP, I had 10 to 15 minutes per patient.
Mm,
Now, yesterday I spent on one of my functional medicine initial consultations, instead of 75 minutes, I spent 90 minutes. But because I had the time to do that,
yeah.
you know,
Yeah. Yeah.
and the patient said to me, do you know what? This is the first time I have felt heard.
Mm,
But it's also because we had a long time to talk, and I
yes.
had time and the bandwidth to actually just go through absolutely everything,
Yeah.
and really listen and really work out, what was going on. And I mean, look at what were the trigger factors in this lady's health journey that's got her where she is today. And what was interesting is she was perimenopausal and she had a massive hemorrhage, which is very common in perimenopause. She had a fibroid, and her hemoglobin went down to 7. And because it was in lockdown, she wasn't offered a transfusion or anything. So she lived with these perimenopausal symptoms and a really rock bottom hemoglobin for a number of years, which then triggered off lots of other health issues.
Mm,
So, it's so important to deal with things in the right way and with correct resources, but that's,
yeah.
an ideal society.
Yes, Dr. Ghazala, and thank you for sharing so much of your insight because it is an absolute normal story. I've interviewed so many women who have never been felt, seen, or heard. It's women's health is severely underfunded and under-researched, and we're just coming out of this now, and people are waking up and putting money behind women's health, and that's very exciting. But there is a long way to go. So we're so thankful for services such as yours and Marion Gluck, where those things are possible. And yes, people should advocate more for themselves. So give us some of your insights, Dr. Ghazala. What are the important things for women in midlife to be aware of, to incorporate in our lives so that we have healthier and longer lives that we can really enjoy? Because there is also this old myth, you're menopausal and postmenopausal, and then you sort of, you're just an old woman.
Yeah, no, absolutely. I mean, look, it's amazing what we can do these days. And certainly, I think everyone throughout life, I think it's really important to have a knowledge about your hormones. Now, there's so many things, even for young women, that you can do to help. Like, people can track their hormones, they can keep a record of how regular their cycles are. Your menstrual cycle is actually a barometer of your health. So when you're a young woman, ideally, you should be having regular periods that are not overly painful, not overly heavy. If there are any issues with that, then that means that there's some imbalance in your body.
Mm,
And so that is something that you need to address. When women get into their 40s, it's really important to have an understanding of the hormonal changes you can expect. Now, a lot of women are having children in their early 40s. So very often women are having pregnancy, often assisted fertility, and then they're going into an early perimenopause. I mean, I see a lot of women who've had repeated IVF treatments, and because their body's just been bombarded with hormones, they very often then will go into the perimenopause earlier because
mm,
also, that's a lot of stress on the body.
yeah.
So, so you'll find they may have young children and they've already started their perimenopausal journey. The things you need to look out that are indicative of perimenopausal hormonal imbalance are if progesterone, if your cycle has become erratic or becoming closer together, if you're having insomnia, if you're having anxiety, any kind of mood changes, if you've got breast tenderness, if you've got weight gain, all of these things can be symptoms of the perimenopause. But even within perimenopause, women have different patterns. So it's important to talk to someone who understands what those patterns could be. Now, the other thing about life in your 40s is that it's actually a time of the most emotional load for a woman. Very often they've got young children or teenage children, long-term relationships, they've got uh, stressful jobs, their bodies are changing. elderly parents. So, women do carry that burden, sort of, even from a societal point of view. So women are usually under a lot of stress, and women also tend to put other people's needs before their own. So they're always thinking about everybody else, and then they're right on the back burner, right at the bottom of the ladder. And that's something that I think is really important to address, that if you don't look after your own health, you're not going to be able to look after everybody else. So focusing on a good lifestyle, so trying to eat nutritiously, understanding what good nutrition is, trying to make the time to do that. When you're very stressed and busy, it's hard to focus on those things. So, what are the quick hacks you can do to eat more healthily, to eat more nutritiously? Try not to drink too much alcohol, minimize, no smoking, try and build exercise. I mean, movement and exercise is actually the most important thing for your well-being. So try not to forget that, and try and incorporate some form of exercise into your routine. Make sure you're getting good sleep. So one of the things that goes out of the window in perimenopause is sleep.
Yeah.
So lots of women have been having insomnia for 2 to 3 years, and then that has a terrible effect on their health. So essentially, make sure all of those things are in place. Minimize stress. Make sure you have positive relationships. For most women, female relationships are hugely important. There's lots of research that shows that actually is hugely beneficial to a woman's well-being. Try and make sure that you're spending time with your partner or your spouse. It's also a time where lots of women can be going through divorce or separation, and that is an enormous stress, because then, very often they're then left with the large amount of the responsibility of the children. So all of these things can have a big impact, but there's a lot we can do to support our health, but we need to focus on it, and we need to prioritize on it, because, what you do in your 40s and your 50s will set the foundation for your health in later life. I see so many women who come to me in their 60s with osteoporotic fractures, and they didn't realize that had they gone on hormone replacement therapy, earlier on, they would have been able to prevent this osteoporosis. So by then it's, we can still support them a lot, but by then the damage has been done, We want to be more preventative.
Dr. Ghazala, so really one should advocate for oneself, take symptoms seriously, seek help, and put yourself first every now and then, and not to live with symptoms for years.
Yes, absolutely. Absolutely. And now, we have so much, there's so many, there are all these AI sort of apps about women's health. I sort of think they have their roles. I think there's no substitute for talking to someone face to face. So even post lockdown, when the Marion Gluck Clinic moved online, I stipulated that if you want me to be your clinical director, I have to have consulting rooms, because I like to see people face to face. And I think that is very therapeutic. I think talking to another individual, the empathy, the understanding, that person hopefully can bring to you, in itself can be very, very therapeutic, but there is so much information online. There's a lot of misinformation. There's a lot of confusion. People are still like, should I take HRT or not? There's many schools of thought. So I think going to someone who knows what they're talking about, who is working in partnership with you as the patient, is not imposing their views on you, I think is really, really important.
Yeah. Dr. Ghazala, I also talk to a lot of women, and they always feel the menopause is a phase, and then you go back to how you were before somehow, right? It's this phase where things are sort of up and down, and then you become a new normal. And I sometimes think, can we bust that myth? Because, do you replace hormones forever? You are not, your body won't produce them anymore.
No. The thing is, when women go through the perimenopause and menopause, there are immediate sort of symptoms that need to be alleviated. So obviously taking the right form of HRT at that transition can be enormously helpful. But we know that these hormones have huge implications for our long-term health in terms of our brain health, our heart health, our bone health, our general well-being, how youthful we are, all of those things, our energy levels. So it's really important to understand that those hormones, once you go into menopause, you will have those hormonal deficiencies. And so potentially, the impact of those deficiencies on your body will go forward. Now, that's
Yeah.
not to say that everyone has to take HRT. It's still a personal choice.
Yeah.
I think that taking HRT definitely improves your quality of life. But there are people who don't want to take exogenous hormones. There are women who've got a history of hormone dependent cancers or breast cancers who can't take it.
Yeah.
And lifestyle can go a huge way to helping a lot of women.
Mm.
However, even with the healthiest way of living, some women really cannot live with those hormonal deficiencies, and it really has a massive impact on their quality of life. In fact, there was a study in the BMJ a few years ago, and it showed that the number of women leaving work in their late
Mm.
40s and early 50s was
Yeah.
huge,
Yeah.
and huge amongst doctors,
Yes. Yeah.
um, because basically women couldn't cope with the demands on them and the fact that their resilience had gone down so much because of the hormonal deficiencies. The other thing is perimenopause and menopause is also a real shift in your sort of psychology. So it's the end of your fertile period. You are embracing the next phase of your life. For a lot of women, a lot of trauma can come up, so the sex hormones are actually quite they sort of um, give you a lot of resilience, because that's your reproductive phase. In terms of evolution, we want the species to go on. So it's like everything else just goes backstage, and we've got to get these women reproducing and keeping the species going. But then once that role has been done and those sex hormones start to go down, a lot of that trauma can come up. So we do see a lot of women who experience many more severe symptoms of the perimenopause and menopause because of that trauma that's come back up.
Mm.
Also, some women can be super sensitive to hormones. So women who are neurodivergent or who have had a lot of trauma can be super sensitive to hormones. So therefore, having personalized treatment where we can start them on very low doses and gradually work up is really helpful for those people. Putting them on a big dose of conventional treatment just sends their body spinning.
Yeah, that was my case, and it wreaked havoc, literally. So, what kind of a leader are you, Dr. Ghazala?
Well, I like to think that I'm a compassionate leader. So I lead by example. I definitely see the most patients every month in the clinic, as well as lead the clinic. And I work really hard, and I work to a very high standard because I want my team members to feel inspired by that, and I think that it does work. And I always want to support the doctors who I lead to become the best doctors that they can. So
Mm.
I provide them with a lot of support. I want them to grow. So, I'm always encouraging them, always giving them lots of positive feedback, giving them constructive criticism where it's necessary. And so we do have a really wonderful team of doctors. We really also enjoy collaborating with each other because we do see complex cases. Sometimes it requires a more creative approach. So I have wonderful colleagues, from many different disciplines of medicine, so genitourinary medicine, anesthetics, who I can talk to. We've got gynecologists, who I can talk to and say, listen, I've got this patient. This is what I'm thinking. What do you think? So we share our knowledge.
Yeah.
And we work together as a team. Marion Gluck Clinic also has the Marion Gluck Training Academy associated with it. So I'm also the lead trainer. So we teach people how to use bioidentical hormones. We're always doing educational events in this field because it's still a growing field.
Yeah.
Really, it's only very recent that the importance of hormonal well-being has been recognized. We've always had endocrinologists who deal with diseases of the hormonal systems, but actual imbalances, perimenopause, menopause, andropause that are recognized as life stages have not necessarily been given the same spotlight that they need, because at the end of the
Absolutely.
day, we need to live well and we need to feel healthy and we want longevity, but we also want a good quality of life.
Yeah. Dr. Ghazala, so what are your plans and goals? What is happening for you? How do you see the future?
Right. Well, we so last year the Marion Gluck owned the Marion Gluck Clinic, and it was sold to a Dutch pharmaceutical company called Fagron. So we're now a much more corporate organisation. So there have been a lot of changes. We've got we've got a much more sort of corporate structure, but then there's also, a lot of opportunity for growth.
Mm.
So we may be potentially opening up Marion clinics, elsewhere. We have quite a huge international clientele, so we would like to, encourage that. We're doing a more diverse offering of courses in this field. We're recruiting more doctors where we can. And yeah, I really, yeah, I feel so enthusiastic about, the benefits of this way of working and of the benefits of the treatment for the women that I'm seeing. I really, every day women say, listen, you've really changed my life. I wasn't able to function before this.
Mm.
I don't want to stop. So, even though I could retire in a few years, I see myself carrying on working. I offer face-to-face consultations 2 days a week. I get two of the other doctors to come on those days because I think even as doctors working in isolation is not really how we used to work. We always worked in teams, and that collective energy was really helpful. So now, I hope that we can offer more face-to-face appointments going forward. But we also have very good facilities to offer video consultations and online consultations, so we can see people all over the country. Before, people had to come to London. Now we can see people all over. So there are advantages to that. But I think that initial contact, and especially for people with complex histories, with histories of trauma, that initial face-to-face consultation, really helps me, really fully understand that patient.
Yeah, and you also lead with that, Dr. Ghazala. You lead with the feeling part of the
Yeah.
of the whole. And so I love that. So Dr. Ghazala, thank you so much for giving us so much information and so much of your insight today. Thank you for leading so beautifully by example, a very important institution, the Marion Gluck Clinic. I want everyone to check out Marion Gluck if you feel like you need a more personalized approach. It has been super important in my life, and I am so grateful for that you're leading at the forefront of women's health.
Thank you. It's been a real privilege to talk to you. Thank you very much.